Hey loves, so this is going to be a video just pretty much touching on how do you know when your patient is deteriorating, or what are signs and symptoms that you can look out for. So the best way to know that your patient is deteriorating is to know your patient, which means you want to make sure that you get a really good report on the patient. You want to make sure you do a really thorough assessment. The biggest thing that's going to save you is knowing that there's a difference in a patient. And then sometimes patients just go bad automatically, and you know, there aren't always signs that something's about to happen. But if you know your patient well enough, and if you are paying attention to the way the patient's vital signs are trending, their general behavior, their mental status, their labs, that can kind of give you a clue into how your patient's doing and if there's going to be something that's going to possibly happen. In a podcast that I actually listened to the other day by Fresh RN, I think the woman who does this, Katie Keebler, I definitely recommend listening to her podcast because she has a lot of stuff on there, and a lot of it touches on critical care aspects. But one of the things they mentioned in the podcast is that rapid response came to be because they found that patients generally have signs and symptoms anywhere till about 8 hours out from when a rapid response is actually called, which means that if you pay attention to these things, you can probably catch something and treat the issue or do something to prevent a rapid response or possibly a code being called. So what are the things that I look for? Keep in mind that I am still a new ICU nurse. I'm still learning every day. There's still things that, you know, I have to pay special attention to because it's not second nature to me yet, but these are just the things that I've noticed. So the first thing that I said is that you want to make sure you know your patient well. You want to know everything from the report that you received. Then you want to go over their chart. You want to know their vital signs. You want to know what it's been for like the last few hours. You want to know if they had any issues for the shift previously, like if they had any PVCs, or if they've had low blood pressure, or if they had like all of a sudden their blood sugar is changing. It's like it's all over the place. It's very variable. You want to know these things. The third thing you're going to want to pay attention to is your assessment. So you want to know when you go into the room and you do your very first assessment, what is the patient like neuro-wise? You want to know, are they awake, alert, oriented? Has their orientation changed? Are they now unable to tell you where they are? Are they now unable to tell you the date? You want to look for those fine things. Now, for patients who can't speak, how would you know about the orientation, or how would you know if there's any kind of mental status change? Here you would focus more on the response to pain, to noxious stimuli. So like if you suction them, do they still have a gag and a cough reflex? You're gonna wanna pay attention to their pupils. You wanna see if they're equally reactive to light. You wanna see if they're now sluggish. You wanna see if their pupils are dilated, or if they're now constricted. You wanna pay attention to any change that was not there previously, because that can give you a sign that something is possibly wrong. Once you look over your patient, you do a really good thorough assessment, I would always go back to the computer again, and then you want to look over their labs. You want to see if their electrolytes are, you know, if they're stable, or if you know a patient is getting a lot of fluid and you're watching their potassium come down, you want to make sure that you do alert a doctor to this, because you want to make sure that they do supplement the potassium, or they supplement magnesium, or whatever electrolyte they may be deficient in. You want to make sure you pay close attention to it. That is the biggest way for you to prevent something from happening. Also, sometimes it's just your gut. You could just feel something is off, and as a new nurse, it's really hard to know if you're just being overly cautious, or if you're seeing something that's not really there. But my advice to you is that if you feel like something's wrong, just have a second set of eyes. You can always ask another nurse to come in and just be like, but there's nothing wrong with asking a nurse or even a doctor just to say like, hey, something feels off with the patient, just can you please take a look at them? Another thing of advice is what I can tell you is that when you go in to see your patient and you notice neuro-wise that something's a little bit different, you want to gather all your information about the patient. You want to know what their blood sugar is. You know, sometimes a low blood sugar can mimic a stroke. So Some of the key things that you can look out for a patient. Say you know everything about the patient. Well, no, say you know as much as possible about the patient, and you've been trending their vital signs. What are the things you're gonna look for? One, you know you're abnormal, so you want to know if the heart rate is less than 60 or greater than 100. You want to know, where does the patient normally lie? If the patient is normally bradycardic and maybe they're really a fit person and they always have a low heart rate, then that's not going to be really shocking to you. If their heart rate drops while they're sleeping, again, that's not really a shocking thing, but you want to pay attention to their trends. You want to know if this person was all day maybe 65 and now all of a sudden they drop to like 35, that's a cause for alarm. Or even if they drop to like 40, still a cause for alarm. So you want to know what the patient is trending. You want to pay attention to blood pressure. You need to know if they're hypotensive or hypertensive, and have they been this way before. So if you see a change in vital signs where their blood pressure was 120/80 all day and then now all of a sudden it's 70/40, there's an issue. You want to pay attention to that. You want to really figure out what is going on with the patient. You want to make sure that the blood pressure is correct. So the best thing to do is put the blood pressure cuff on the other arm and retake the blood pressure to see if that is a true blood pressure. Another thing is you want to pay attention to their pupils that I mentioned. You want to pay attention to their change in mental status, if they're no longer oriented, or if there's anything that just seems like it's not right. Also, pay attention to what your patient says. A lot of times patients have what they call the impending doom, that they just feel something's wrong and they say that I feel sick, or if they say I want to die, or they feel like they're about to die or anything like that. Definitely pay attention to that, because patients can feel something off in them before you may possibly see it on a monitor. So you want to pay attention to what your patients are saying. And I would also say, like, if you feel that something may be off or wrong and you think that it needs to be changed, discuss it with the doctor. Don't ever feel like, oh well, they know this already, or day shift already told them, or night shift already told them, or whatever. You never know what somebody knows until you are able to confirm that. So don't assume that somebody knows that this patient has been having PVCs all day, because maybe nobody checked the strips and nobody mentioned it to the doctor. Maybe the patient doesn't have labs ordered and they need labs, but there hasn't been anything in. You want to make sure that you verbalize this. That way they do order labs and you are able to see if maybe the patient is hypokalemic or hyperkalemic or whatever. But I think it's really important that if you feel something is wrong, is make sure you address it. Get a second set of eyes, ask the doctor what they think. So that's my tips for how do you tell if a patient's deteriorating. There are always a lot more signs, but these are just like the main things that I would look for just for I don't want to say a basic patient, but just that if something was happening with my patient, I'm going to be really paying attention to their vital signs, really pay attention to their mental status change, pay attention to their neuro, their pulse, and then just how the patient is stating how they feel. There may not always be a sign though. Sometimes everything is good and all of a sudden a patient may code. You may not have any kind of hint that this is going to happen. But if you pay attention to things more often than not, you could possibly stop something from happening. So I hope that helps. If you guys have any other questions, let me know.